go ahead and get started. So welcome everybody. Welcome everyone for joining us. Good morning, good evening, good afternoon for some of you. Thanks for joining us. We're very excited to have you all here today. My name is Robin Al-Haddad, and I am the Community Manager for QualME, which is IDEAL's Qualitative Monitoring and Evaluation peer community. I'm really happy to be welcoming you all here to this session on participatory qualitative tools and approaches to support adaptive management. So this is a peer community, and as we would like to get to know each other better, I see many people are putting their intros into the chat, so please continue as you're coming in. If you could put your name, your organization, the position where you're based, and you can put all that into the chat. Before we get started, we just want to inform everyone that we will be providing French interpretation during this meeting. So please click on the globe, the interpretation globe at the bottom of your screen, and select your preferred language, either English or French. It doesn't matter if you want English or French, you need to select your language. Unfortunately, the interpretation feature is not available if you are connecting from your phone. We also want to let you know that today we'll be presenting slides using multiple screens simultaneously. So at the top of your meeting, you'll see a green bar, and next to it, you'll see a drop down that says View Options. View Options on the drop down list at the top. And you can choose to view your slides in either English or French. So if you would like to view in English, you will choose for Matheson, who is advancing our slides in English, and you can choose Hannah for seeing slides in French. And finally, we want to mention that when we go into our small groups, we will have separate English and separate French breakout groups. We will put all the French speakers together in groups and English speakers in other groups together in separate rooms. So if you are interested in being in a French breakout room, please use the chat box so that you can let my colleague Bella Gerthofer know, and she will be able to support you. Bella is our technical lead for today's event, so her title is Ideal Technical Support. You will see her Zoom title. Maybe Bella, if you could just raise your hand, make sure people know who you are. So if you're interested in being in a French breakout room, please message Bella privately and let her know that that's what you're interested in, and she can support you. Also, just a few basic reminders and house rules, please. Remember to mute your microphone when you are not speaking so that we don't hear a bunch of background noise. You can use the chat box or the raise your hand button if you have a question, and we will call on you. We'll try to get to as many questions as we can in the short amount of time that we do have here. If your bandwidth allows, please turn on your video when you are speaking so we can get to know each other and see your face. We are recording this session today, and we will be sending out the link to the recording after the event is over. We also want to tell you about the QualME. QualME, these events generally are held once per quarter, and each meeting has a different topic of discussion. So today's meeting, we're focusing on participatory qualitative tools and approaches to support adaptive management. And this meeting is really intended to give us a very brief overview and insights into just a few unique participatory methods and tools that can be used in qualitative studies. So for our agenda today, we'll hear from colleagues from Catholic Relief Services, or CRS, and also from CARE, who are grantees of IDEAL's QPIA Small Grant Awards. So in September of 2019, with support from USAID's Bureau for Humanitarian Assistance, IDEAL invited both emergency and development organizations to apply for a Qualitative M&E Program Improvement Award, which is QPIA. And under IDEAL's Small Grant Program, implementers of emergency and development food security and nutrition activities have had the opportunity to pilot innovative approaches, document their learning, develop tools, and pursue projects that will contribute to improved design, implementation, and overall effectiveness of food security and nutrition programming. So we are excited to have 2 awardees with us here today to showcase their work. You can find more resources and publications from the small grants on the FSN website, and Bella is posting a link in the chat. So if you're interested in learning more about the small grants and the things that they produce, you can look at that on the FSN website. And then after our plenary sessions, we will break out into small groups and we will have individual discussions. We are a community here, and we want to create a safe space for communication. So we want you to hear from all of you, whether you are new to the field, whether you're a leading expert. We really encourage you all to share your experiences in the breakout rooms. And again, remember, if you are interested in being in a French breakout room, please use the chat to let Bella know, and she'll be able to support you. Okay, so the first thing we want to do before we get started here, just to get things rolling, we're going to do a little chat storm. I see people are doing a great job at putting your name and information into the chat. But now I have a question for everyone, and I'm going to ask you all to respond by putting your answers into the chat. So the question is, what examples of participatory data collection methods have you used in your research? So that could be participatory mapping, participatory videoing, collecting most significant change stories, using photo voice, seasonal calendars. There's lots of different participatory qualitative data collection methods. So I'd like to see you all answer that question and put it into the chat. What examples of participatory data collection methods have you used in your research? And post your response in the chat for us. Oh, I see some photo voice, outcome harvesting, participatory allocation mapping. Oh, that's great. Seasonal calendars, Transcend Walk. Oh, I see several photo voices. That's great. Outcome harvesting, outcome mapping. All right, great. All right, so now we're going to turn it over to our first presenter to share her experiences. First, we would like to welcome Cara Rabo-Arianelina from CRS, and we will hear from Cara on how CRS uses community-based participant-led visual monitoring tools and methods to support adaptive management. So Cara receives her PhD in Rural Sociology and Human Dimensions of Natural Resources and the Environment from Penn State University. She's a passionate applied researcher committed to promoting research for intentional learning that benefits farmers and rural communities. Cara's commitment to research that enables communities' interests and voices to be heard has led to her facilitation of numerous participatory monitoring, qualitative and mixed method studies in over 13 countries in sub-Saharan Africa. And currently, Cara is the strategic learning lead for the Mahara Resilience Food Security Activity for CRS in Madagascar, where she applies her research expertise and dedication to community engagement to lead co-learning for program quality improvement. So as Cara is presenting, please feel free to write your questions in the chat. She will get an opportunity to try to answer your questions immediately after her presentation. We'll have a few minutes for Q&A, and so please feel free to write your questions in the chat or raise your hand. Now over to you, Kara.
Thank you so much, Robin, and thank you everybody for joining me. Before I go on, can you hear me all okay? The audio is good?
It's a little quiet, but we can hear you.
Let me fix the microphone. Is this better?
Yes.
Okay, great. Thank you again. And I'm going to be giving you a very brief overview of our participant-led visual monitoring tools for resilience and community visioning in southern Madagascar through our Maharu Resilience Food Security activity. Next slide, please. The Maharu RIFSA is a 5-year program funded by the Bureau of Humanitarian Assistance within USAID. Our goal is to prevent and sustainably reduce acute food insecurity for the most vulnerable, especially for women of reproductive age, youth, persons with disabilities, and most vulnerable households. We are operating the RIFSA in the deep south of Madagascar, as you can see from the map on the right, in the Tsimouan-Drifana region, Ampani district. The yellow are Beilu and Sium Bay districts in the Anduri region. And the goal of our program is to really help communities build recovery towards resilience. The context in southern Madagascar is one of great chronic stress and shock. The region undergoes a lot of cyclical and historical climate variations, including prolonged droughts, dry spells, high winds. Therefore, our goal in our program is to work together to build individual and community resilience so they can achieve sustained food and nutrition security. Next slide. Within Maharu, our community visioning approach is really rooted into doing community development based on communities' needs, objectives, and their shared vision. We take a truly participatory approach, building off of existing PRA techniques, and really rooting them into a community visioning process that drives sustained change based on collective vision, community actions, to build resilience and food security. The approach of the Maharu community visioning is really rooted in community inclusive dialogue for mobilization, building trust between program participants and the program. The idea is by building trust, we create sustainability for continued sustained change, and together in that partnership can work together to help improve communities' lives and their future. Next slide, please. The objectives of this ideal sub-award were basically to take the existing community vision approach from Maharu that was quite participatory, highly interactive, and build on how those data were captured, analyzed, and represented to really achieve collaborative participatory monitoring for community visioning and resilience. We use this program to develop a proof of concept to really examine how our community visioning tools could be added and leveraged using existing ICT4D digital capture in the facilitation, in the capture, and in the analysis, while at the same time proceeding through the traditional, or I would say the more facilitative participatory tools. These data were collected concomitantly alongside each other, so we did not take away of the participatory nature of the original approach, but we added to that. And the idea was we wanted an improved monitoring system that gave us live and actual data in time that we could use to improve our Maharu adaptive management processes and look at these to co-analyze together with program participants and project staff. Next slide, please. Here you can see this is the overall process for the community visioning. We have 6 tools. I'm not going to go into each one of them as we just don't have time. But the beginning start of community visioning is the first one on the top left, is where the community comes together and identifies what is their collective vision for the future, proceeding to looking at what their resilience capacities are, looking at vulnerabilities, identifying community capital assets and resources at hand that they can use to leverage to develop a community action plan. And alongside that, with community volunteers and program RIFSA staff, the community identifies what are the leverage points based on vulnerabilities where they need additional technical support, identifying further solutions and prioritizing these actions, and finally with a shared engagement where the project and participants come together and say, we commit to working together to achieve these collective goals. Next slide, please. So the idea here, based on the CV process you just saw, we developed a digital system alongside each of those 6 tools, where while the community facilitated discussions were happening to really draw out that voluminous qualitative data and voices and community perspectives, our facilitators were collecting these data in real time using a ComCare platform and Android tablets. This then allowed us to develop a whole monitoring system for each of the 6 tools that we could use then to analyze and visualize using our data dashboard. You see that here we use Power BI, but any type of data system can be used to create a similar ICT4D monitoring system. We only did a small sample of sites because we really wanted to demonstrate the proof of concept of this monitoring system to identify its added value. So we refined and tested these tools, and we basically built this from scratch. It did not exist, as far as I know, in any of the community visioning work done within RIFSAs. So we really, tried and tested, field tested, tried again, and then we proceeded to collect the data, again, focusing on visualization to help streamline analysis and interpretation. Next slide. This is just an example. This is the resilience and vulnerability analysis. In the field during the discussion, participants have a large poster paper. They're taking together, based on discussions, identifying and prioritizing what are the 4 main livelihoods that exist in the community. You see that is in blue. And again, what are some of the specific 4 main shocks that they face? That's in red. And then what are the 4 main stresses? After they identify this is what we are facing, this is what we are seeing, they then proceed to discuss, okay, what is the degree to which we have control over these? The outermost ring that you see here means that they have no control. And so as they're doing this, they're placing seeds within this wheel to demonstrate their degree of control. The middle ring indicates they depend on external actors to support them to address this problem or shock. And the middle ring demonstrates resilience. So there, that means that they have control over those different factors. And together we took these data as the participants were discussing, placing their seeds. We had a mimicked digital system through ComCare platform where we were collecting the information in real time. Next slide, please. Here you can see a kind of aggregated analysis to visualize the data. This is for one of the districts in Beilu. You can also then sort the data by gender, by agroecological zone, and also different components. This is specifically for the whole district of Beilu. I'm sorry, I don't have it in English. Oh, this one is English, sorry. So you can see the green is what they have control over. The yellow is they're externally dependent, and the red being they have no control. So we're able to visualize these data to look deeply into more of the trends and help us assess what the different resilience and vulnerability aspects are. Next slide. The other tool that I wanted to mention today is the community capital analysis tool. This is a really critical tool and a very key method in our zone, as many of our participants are illiterate, and we wanted to create something that was engaging. So together, the participants come together with pre-selected images and talk about the various capitals or resources they have at hand. So from financial, physical, natural, and social capital, they discuss, okay, what do we have here? How can we use these different assets? Can we use this to achieve our collective vision, to address some of our vulnerabilities, as well as to achieve our collective action plan? And the great point about this is if they don't see a particular image that is there, they can also draw it and it becomes part of the assessment. And the idea is here, the follow-up discussion is, for example, if we're talking about social capital, individuals might say, okay, within social capital, who do you go to outside your household when you have a problem? What are your different social safety nets? So these are some of the aspects here. And in the next slide, we can show you how we analyzed those data and represented them. Again, here you can see this is one focused on financial capital. Again, I'm sorry, this is in Malagasy, but the top starting umbi, so they're talking about main on the right is livestock, cattle, sheep, honey. So they're talking about the different financial capital they have access to that helps them achieve. And again, you can sort these by gender, and this one is particularly for women, and this is across all districts. Next slide. So overall, our goal for the IDEAL program within this was to really focus on, by doing an ICT4D participatory monitoring system, how did it make our data more usable and shareable? How did it help us get more information that was relevant not only to us as a project, but also to participants? And more importantly, our goal was to reduce the time it took to analyze these data so we could use this information in our adaptive management processes, as well as in targeting specific interventions and programs, even at the Fukuntani or the district level. Next slide. So what did we learn? This is a very brief, I know this is a lot to take in. I have to say a great learning from the team was it's hard to break old habits and mindsets, and it can challenge internal dynamics. Many of us who are used to participatory approaches, taking a quantitative look at it or developing a new system, we received some resistance. It took some time to convince others. And I think that that's true when trying anything new, but I think that needs to be considered when developing new ideas, and we have to ease into that. It's also true that the community members viewed the tablets, the digital system, as creating more legitimacy for the process. They felt that they were eager to share. They said that it helped them it helped bring more authority to their voice, to their perspective, and they felt they were taken seriously more when we had this kind of digital system established. At the same time, there is need to integrate more of the community visioning results into adaptive management processes more regularly. It's important to really plan ahead of time and create enough time to do the system as well as the analysis. And specifically, our team noted that we have to create more linkages, identifying community vulnerabilities with the specific RIFSA leverage points. And that should come out in action planning and prioritization. On the other side, in terms of staffing, it's really important to have the right staff with the right competencies. We had some amazingly talented staff who built this from scratch. And without them, we couldn't have done this. So that needs to be considered. And we also need to have more time and effort in development and kind of a beta system, I would say, and also for field testing, because internet connectivity in some areas can create challenges. And also there's need to create time for analysis and put that into the planning. I would say the package that we've developed for the CV monitoring system is a great asset and can help other programs that are doing similar CV implementation in RIFSAs and other programming. Next slide. Finally, our recommendations and next steps. Again, having the right staff to do this work is really important. So it's important to do that at the recruitment stage to really focus on the skills needed to do this kind of monitoring. Also, I would say not just hard skills, but soft skills, openness, eagerness to try new things, patience, flexibility. And in terms of the field work, it's really important to note that during some of our sessions, we received 200 participants in some locations. So it's really important to record discussions if you have limited facilitation support. And for our context, as we are basically an emergency program seeking to do development, context matters when doing community visioning and when doing this type of monitoring. We have to be cognizant of the ethical aspects and really go alongside the community and be aware of what's going on when we continue to do these types of community visioning processes. At the same time, there's more staff time that's required to gain trust, and that needs to be considered as we plan. I would say for us as a program going forward, we are looking at the cost-benefit analysis for doing this type of scaled participatory monitoring for community visioning for our follow-on RIFSA. It's really about staff and resources. For our context in Southern Madagascar, I know from others in Zimbabwe, CARE, CNFA, many of them did it in over 500 sites. Where we are in Southern Madagascar, limited road infrastructure and resources really might not be feasible for such a scaled approach. And again, a final great learning from our team was it's important to embed in these processes aspects of social behavior change. So if we're getting 200 people in one site and there is no improved pit latrine, our team should be thinking, this is a great opportunity where we can do a session about wash. We can do an improved pit latrine construction with our team, and this can be embedded into the programming. And that's a great aspect of integration as well as sustainability. Next slide. Finally, I want to thank the over 45 staff within CRS Madagascar, our social behavior change, our learning teams, our meal teams, our ICT4D communications, as well as our partners within the CDD, Diocese and Tuliar, community volunteers, and the over 800 participants who helped us make this CC Ideal program a great success. Without all of you, we would be unable to do this webinar. We would be unable to share this great learning, and we're very, very grateful for these efforts as we help to improve the lives of the people in Southern Madagascar. Thank you.
All right, well, thank you, Kara, for sharing about the CRS community visioning. We can now open it up to questions. We are a bit short on time, so we won't have a lot of time for questions, but if you do have questions, please raise your hand. I see a couple of hands raised. Wilson, new?
Yes, yes. Can you hear me?
Yes.
Great. Thank you for the presentation. I just had a question on that diagram around where you had all the flow of the data. It looked like that you guys were using Power BI and ArcGIS, and some of the visualizations you showed, it looked like it was more quantitative data. Could you talk more about the qualitative data you collected and how you analyzed it quickly? I think that's a challenge I face, is how do we analyze qualitative data quickly? Thank you.
Right. So that is a great question, and thank you. And I wish I could have gone into all of that detail. So basically, during each of those 6 CV tools, we have numerous qualitative data we're collecting. We did use digital recorders, and we collected those narratives based on specific questions regarding participants' choices, perceptions, and we then used those data and uploaded them into a qualitative data software tool. We used NVivo. We did a lot of, thematic coding, categorization. We did take a lot of these data were qualitative and then paired it with the existing data we have. So we combined both of them. And the idea was, it was enabling us to get more of a richness of the narrative and the why, or, the how things are happening. And we analyze those alongside with the different data that you see that's visualized in the data dashboard. We used ArcGIS. We also did visualizations to see the different trends and how they differed across space in the different ecological zones and the different districts. We were exploring that as an option, and see now, because our sample size was so small, the use of like spatial regression, that kind of thing didn't work out, but it was a way to kind of test it. Again, it was a proof of concept and to look at the utility of those data. I hope that answers the question. And thanks for the question.
Yes, thank you.
Yeah, great question. We have time for just one more quick question. We're a little over time, so does anybody else have a question? Kara, what actions do you guys take to ensure that the most vulnerable populations, like people with disabilities, elderly, how do you ensure they're engaged with the community visioning process?
That's a great question. Thank you. Yes, persons with disabilities and the vulnerable are a key target group for our program. I mean, that is the whole point. Inclusion is a big component. And the first day of the community visioning process is all about kind of the welcome. We really ease into it. We are working with Humanity Inclusion International. They are a partner within the Maharu program. We are ensuring that inclusivity and equity is a key aspect of all of our technical interventions. So for the community visioning process, it's meeting their needs. It's going maybe to different households, maybe going there to have sessions, the idea is really trying to make sure the approach is more inclusive to get more participation. And yes, it varied by district, it varied by location, but we always had that in mind when we were doing the sessions, and to make sure that we got as much participation as we could. And as I said, in some locations, we got up to 300 people.
Wow.
In others. So it was a very intense, a very dynamic, and a very lively discussion. And it was participation was never a challenge. But from persons with disabilities, we did definitely, that is a big part of our programming. Thank you.
Right, I do see there is one question in the chat. It's in French.
Is this the last question?
Yeah, I'll give you one more question if you can answer quickly.
Okay, let me switch to French. Okay, oui. Ok, donc si je peux expliquer la gestion.
Interject.
Non, ça ne marche pas?
Sorry, who's that?
Si ça marche.
Okay, I'll just stay with English. Sorry, I was going to continue in French, but I will do it in English just to be quicker. So yes, the aspect of adaptive management, the reason for doing this project was to help have data in a more timely manner. The volume of qualitative data that was coming out of these 6 tools had taken our team quite a long time to analyze manually before. So that was the justification of the program. And it was taking some aspects of making the qualitative data kind of quantifiable. However, the narratives and the why and the how was all a part of the program, combining those 2 types of data together to come out with a more holistic view. And that's, I didn't get into the detail about how we organize that. It is in the final reports. And I would say what's the most important aspect of this process? Patience, flexibility. I would say also staff that are open to both. We have some that might, oh no, quantitative, oh no, qualitative. You have to be flexible and develop systems and work with people's talents. And yeah, it takes time, but I think that it definitely reaps many rewards. And it just needs to be planned accordingly when doing this kind of work. Thank you. I hope I answered the question.
All right, great. Thank you so much. Okay, let's now see how our next presenter has used participatory outcome-focused monitoring tools in their work. So our next presenter is Caitlin Shannon from CARE, who will be presenting on some interesting and very innovative participatory methods, including most significant change, outcome harvesting, and outcome mapping. So Caitlin is the Director of Research at CARE USA. In her role, she leads multidisciplinary and multi-sectorial research practice across CARE's global federation, including research implementation, capacity strengthening, partnership development, and research translation. She has more than 2 decades of experience designing and leading field-based research globally with a focus on reproductive, maternal, and child health. And prior to joining CARE, she served as a research director for engendered health, was on the faculty at London School for Hygiene and Tropical Medicine, and worked with Doctors Without Borders. Her research has been featured in many journals, in the Lancet, in the Bulletin of the World Health Organization, BMJ Global Health, the Global Health and Science Practice Journal, and more. So Caitlin, as Caitlin is presenting, please feel free to write your questions again in the chat, or she will be able to have an opportunity to answer the questions immediately after the presentation. So thank you. Now over to you, Caitlin.
Thanks, Robin, for that warm introduction, and thanks for having me here today. I'm very excited to present on the work that was done by my colleagues at CARE USA. So next slide, please. As Robin has indicated, the objective of the work that CARE did under this grant was to pilot the use of participatory outcome-focused qualitative methods for monitoring in the context of resilience and food security activities. And based on the learnings developed during those pilots, to develop and finalize a guidance that could be used by a range of actors implementing similar complex development programs. So just to begin quickly with the methods in a nutshell. So we trialed or piloted this work with 3 different methods: the most significant change method, outcome harvesting, and outcome monitoring. From the chat storm, I can see lots of folks have experience with some of these methods, less experience with other methods. But I just wanted to begin by saying that these aren't necessarily new methods. These methods have been around in some instances for more than 2 decades. Most significant change practice emerged sometime in the 1990s. The first guidance document for outcome mapping came out in the early 2000s, and the kind of seminal guide on outcome harvesting was published in 2012. So these are not new methods, but I think, development professionals and M&E professionals have really, more and more been using these in the context of monitoring. So again, we experimented and piloted with how these can be used and whether and how they could be blended or combined, again, for the purpose of monitoring within the context of these kinds of programs. As the title of our pilot or work or program indicates, our work was really focused on outcomes. So these methods all focus on capturing changes or outcomes that are happening at community level. They all have different sort of processes that are undertaken to generate the data on those outcomes, but all engage a range of stakeholders in that process and can be used for a variety of purposes within the program lifecycle. So next slide, please. So just to give a little bit of a sense of the steps that are involved in each of the different methods. Again, they follow sort of a similar process of, harvesting data on outcomes or changes that are happening, processes of engaging different stakeholders in prioritizing, substantiating, and otherwise sort of understanding the significance of the changes. And then the data that's generated is then analyzed in some way to answer questions that are the basis of any particular monitoring exercise. Next slide, please. So why did we choose these methods? Really, the reason why was a practice gap. How do we address the practice gap that we were seeing and experiencing within our RIFSA programs? So the first reason or gap being the lack of evidence, particularly on unexpected outcomes. So a lot of times our monitoring systems are designed to track certain outcomes or outputs, but are not necessarily designed to really understand what kinds of unexpected, including negative changes that may be happening during project implementation. In addition, there's limited documentation about whether and how the project contributed to the change. So that richer kind of qualitative data on the how and the why is often lacking. But that information is really vital for us to learn about what worked and how to build on successes or failures. And also limited data to inform the review of theories of change, which in turn limits the function and relevance of theories of change. So the value add of these methods in addressing these practice gaps are, one, obviously that they're qualitative. They give us that richness of data and insight and that explanatory value that really inheres in qualitative data. They're outcome focused, so they really allow us to understand whether and how change is happening. They're participatory, they're complex aware, and to some extent they're intuitive, but we'll talk a little bit about that particular last value add and some of the lessons that we learned. Next slide, please. So we piloted these 3 methods as monitoring tools within two of the RIFSAs that CARE is the primary implementer on. First was the Hamzari project in Niger. What I wanted to point out is we selected two different RIFSAs that were in different stages of implementation. Again, to see, what kinds of, among the methods, which might be more useful in different phases of implementation, and also how we can, how the data that are generated by these activities can be used in different stages of implementation. So for the Hamzari project, which is again one of CARE's resilience and food security activities funded by BHA, we piloted it with the Hamzari program, which again was in mid-implementation. As part of the pilot, staff from both the Hamzari project and the Shuhardo project, which I'll get to next, participated in a quite extensive virtual training on the methods, and then worked over several weeks to design the pilot. So the our Hamzari colleagues chose the MSC method, and I just wanted to briefly flag, because I think it's helpful to know why they chose MSC and chose to have MSC as a standalone method. One is the main reason is that since the final year of the Hamzari program was underway, the focus of the exercise was primarily on documenting whether and how change was happening, both for the purposes of accountability, but as well as for adaptive management as the program entered late implementation. So the purpose really here was to understand the kinds of behavioral changes that were emerging among participants in Hamzari's maternal child nutrition, social behavior change interventions. So the participants were of the exercise were the participants of those interventions, being mothers group participants, adolescents, as well as fathers that were participating in husband schools. Data was collected through a combination of focus group discussions and in-depth interviews. And the audience was a fairly broad audience given the purpose. And again, really the use here was on adaptive management, program learning, and progress reporting. Next slide, please. So the other RIFSA, CARE-led RIFSA that participated in this work was the Shuhardo 3 program implemented by CARE Bangladesh. And they were entering late implementation, so they were almost finished with the program, but were preparing for a follow-on program. Really the purpose of the exercise, therefore, was to understand the changes local service providers had experienced and how those changes were contributing to program impact and sustainability in order to help to revise the design of the follow-on phase of the program. So again, for the purposes of adaptive management, as well as for program learning and progress reporting. The Shuhardo 3 staff chose a design blending outcome harvesting and most significant change because program staff really wanted to assess changes among local service providers and in the community related to the Shuhardo service provisioning model, and really to understand how the program had contributed to those changes and their significance. And additionally, program staff wanted to understand whether there were unexpected or negative changes that were happening either for LSPs, for the quality of service delivery in the program area, or in the communities where Shuhardo 3 implemented the service provisioning model. So next slide, please. Obviously, we don't really have a lot of time to, really kind of dive into the depths of, the results that were generated through both of these pilots. So I just wanted to highlight one snapshot of results. This is from the pilot that was conducted by our Hamzari colleagues in CARE Niger. This is from the interviews that were done with participants of adolescent participants of the Safe Space program. So again, many different significant change stories were captured, and then the kinds of changes that were collected, were quantified in over several different domains, but also the stories themselves were used as a source of data for helping to answer the questions. So this particular story, the most significant change was that this girl really felt like her participation in the Safe Spaces program was a platform that prepared her and strengthened her in terms of her empowerment in the face of harmful social norms. So again, I think this highlights both the way that we were able to sort of quantify and see some trends in terms of types of changes, but also get really a sense of what those changes look like and the significance of those changes to program participants. And really this helped the program to understand whether and to what extent it was really being impactful in the way that it was designed, and provide some insights that allowed for further refinements of the program strategy. So next slide, please. So what are some of the lessons we learned? Lots of richness of lesson learned. I won't have time to kind of dive into the details of a lot of the lessons that we've learned. But from the Hamzari pilot, we really learned that both having staff capacity to implement these types of methods is absolutely essential, but was quite lacking. So, there was a real intensity of the training and the support that was necessary in order to be able to have a quality activity. Staff participation beyond M&E staff was absolutely critical. Staff definitely faced some obstacles in terms of the analysis. I think Kara spoke to this as one of the reasons why they designed their pilot. Being able to analyze volumes of data in a timely way in the context of program monitoring is definitely a challenge, and one that certainly we generated some learnings on what might support more efficient and effective analysis in the future. I think, in terms of some of the more positive lessons, I think similar to the experience that Kara shared, participants were really excited to be able to be part of this exercise and really share their stories and their experience, which I think is one of the true values of this kind of an exercise. One thing that I wanted to highlight in terms of sort of how the results were used for adaptive management, there are definitely some lessons learned both from the Hamzari pilot and the Shuhardo pilot with respect to this. But just zeroing in on the Shuhardo 3 project, the pilot study played a crucial role in identifying essential adaptations needed to ensure the sustained delivery of the local service provision model in remote communities in Bangladesh. As a response, the program aimed to create a more unified network of, that connected all service providers, including government and public entities and local service providers. So the learnings and the insights generated from the pilot allowed, the Shuhardo 3 staff to really see the value and need for that kind of networking of service providers. So that was one of the adaptations that emerged as a result of this pilot. Next slide, please. So in terms of the guidance document, I won't have time to get into it. Links to the guidance document, once it's available on the IDEAL website, will be certainly shared. And we're very excited and hopeful that folks across the sector will be able to take use of and see value in this guidance document. But the guidance is separated into 2 parts. The first part really provides some high-level guidance on using these methods in the context of monitoring. And then the second part focuses in on the kind of process of qualitative monitoring with these methods, sharing some good practices, some guidance on when to use these different methods, how to think about choosing or blending these approaches, and what it really takes to be able to use these methods well, as well as some of the limitations and challenges. There's extensive annexes that provide resources, good practices, templates, tools, and guides. So we're really hopeful that this will be a useful useful resource for the community. Next slide, please. I just really want to extend a note of thanks. There were innumerable people that made this work possible, including our colleagues in CARE Bangladesh and CARE Niger, whose hard work made this learning possible, but also to the participants in Bangladesh and Niger who volunteered their time to share their stories and experience. And a special thanks to the core project team, Richard Smith, Rakib Hassan, Yasin Ali Sarkar, Leah Dididze, and Mara Russell. Back over to you, Robin.
Great. Thank you so much, Caitlin, for sharing about the participatory outcome monitoring methodologies that you all have used at CARE. We have a few minutes for questions. We are running a bit short on time, so if anybody has questions, please raise your hand or put them in the chat. I do see from the chat that there is a lot of excitement about this guidance document that's going to be coming out soon, and we will definitely make sure we send out a link to everybody as soon as it's published on the website. It is in production at the moment, but it should be out very soon. But does anybody have any questions that they would like to ask Caitlin? We also have several other team members here from CARE. We have Rakib, Laji, and Richard, and Mara, who are all here from CARE, who can help answer some questions.
I do see that there's one question from Kara in the chat.
Oh,
so I'm
yes.
happy to start with that one. It's an excellent question, and I feel like I don't have a good answer for you, Kara. So the question is, in relationship to outcome mapping, as you probably heard, outcome mapping wasn't one of the methods that was selected for the two different pilots. So we didn't really have to navigate the literacy challenges that inhere in doing outcome mapping with communities where literacy may be of concern. So I would say in the context of this pilot, we didn't really learn anything about that.
We are very short on time, so now we need to move on. Sorry, but we can continue the conversation into our small group discussions. We're going to try and take about 30 minutes to go into small breakout groups, and we welcome you all to share your own experiences, your own examples in the breakout rooms. We probably will not have time to do a report out after the discussion in the breakout. We may just ask you to report out into the chat. Unfortunately, we're short on time for that report out. So we do have a few people. We're going to break up into, I believe, 8 different rooms, and we're going to have a couple of rooms for French speakers, and the rest will be for English speakers. We have some discussion questions that Bella will post in the chat, and we'll make sure all the rooms have their discussion questions. But those rooms who are, I believe it's rooms 1, 2, and 3, who are the CRS rooms, we have questions that are around: how has your organization supported new approaches to qualitative monitoring that requires changes in staff mindset or to new ways of thinking? What approaches do you use to support and improve internal and external collaboration as you navigate implementing these changes and new ideas and approaches? And then what challenges have you faced in your program or organization to support participatory monitoring and qualitative approaches? And then those who are in the CARE rooms, I believe those are rooms 4, 5, 6, 7, and 8. What do you think the benefits and challenges would be to using these participatory outcome focused methods for monitoring? And similarly, also, what challenges have you faced in your program or organization to support participatory monitoring and qualitative approaches, and how have you overcome those challenges? Welcome back, everyone. It seems like we had a really good conversation in those breakout rooms, but our time has been cut short. I would just ask if you all could maybe just post some of your highlights, your 2 or 3 key takeaways from your discussion. If you can post them into the chat. we are short on time, so we're not going to have time to do a readout from each group. But if we could just start posting some of our 2 or 3 key highlight takeaways into the chat, that would be great. Our group in particular talked about time sensitivity, especially for emergency programs, and the limited resources we have to be able to conduct these sorts of participatory methods, and how to validate the data was another question that came up. All right, I see people, some groups posting in the chat. That's great. All right, well, thanks everyone.
Robin, can I?
A great conversation today, and thank you to our presenters, Kara and Caitlin. We greatly appreciate you taking your time to share your knowledge with our community. It's great to have these exchanges of good practice. And thanks again to Kara, Duel, Damwena, Caitlin, Rakib, Laji, Richard, Hannah, Matheson, Eason, Paul, and Frank, who all helped to facilitate our breakout rooms. Thanks again also to Bella for being our technical lead today. Unfortunately, we are out of time, so we're going to have to wrap up. But we do have a final request, and we would ask everyone to please click on the link. I believe Bella will post it in the chat. Or you can use this QR code that's come up on your screen to please take a minute to just do a short evaluation survey about today's event, because this helps us enhance our future events and makes them better. And if you think you might be interested in joining the QualME peer community, there's an opportunity to indicate your interest in the evaluation form. So please do that if you can. We will be sending out a follow-up email after this event within the next few days. We'll send out materials from today's event, including the recording of the session, the slide decks that you all see here today, some of those resources that were highlighted by our presenters. We will try and send out links to all those resources. And please be on the lookout in the FSN newsletter for upcoming events, these QualME event series. You can also join, we have another event from the HUMEL peer community. That's the Humanitarian Monitoring and Evaluation and Learning peer community. They have a learning session that's coming out on September the 25th, so just a few days from now. It's on outcome measurement in humanitarian settings. It's also online. To register the event, I believe Bella will post a link in the chat about that HUMEL event if you're interested in registering. And thank you all for joining us. Bye and have a great day.